As you can clearly see, all 6 of these patients experienced a reduction in their muscular-spinal abnormalities while on the BA10 program. What is significant though is that their symptoms reduced proportionally as their muscular-spinal abnormalities reduced, and 5 out of these 6 patients returned to the workforce to earn an income and pay taxes again. As a natural therapist specialising in treating people diagnosed with either of 9 rigidity autoimmune disorders like Parkinson's disease, MS and irritable bowel syndrome, I've discovered that there are 24 symptoms common to all 9 of these disorders I cater for. I also discovered that these 24 symptoms are not caused by 9 different incurable diseases, but by neck and back muscle distortions provoked by excess tension pulling the spine out of alignment to put undue pressure on the spinal cord and nerves exiting the spinal cord. Finding these tension-provoked back muscle distortions and the spinal abnormalities they cause and correcting them has enabled me to help many patients of these 9 disorders into remission. Take a look at some back muscle comparison photos of 10 patients diagnosed with 6 different disorders and see how they all have these musculoskeletal abnormalities whilst they all have the same symptoms. Alright, so I've chosen 10 rigidity autoimmune patients who I treated, and I'm going to show you close-ups of these files in a minute, who all had exactly the same symptoms, but between them they were diagnosed with 6, not just 2 or 3, but with 6 different rigidity autoimmune disorders. And to prove they all had the same causes for those symptoms, I paired them all off with another patient from the group who was diagnosed with a different disorder so that I could give you proof in the way of x-rays and photos of back muscle distortions and posture abnormalities to clearly show you that all symptoms of all 10 of these patients were caused by musculoskeletal abnormalities that can often be overcome in 4 to 14 days. So, firstly I want you to compare Michael's cervical x-ray with Bart's cervical x-ray to see that both their cervical spines have straightened out, which puts undue pressure on their brainstem spinalis, and any chiropractor can confirm to you that they both have a C1 subluxation. Then I'd like you to compare their lumbar x-rays to see their lumbosacral curve. Then I want you to notice this tubular tunnel of muscle within the red bracket there on both of them. Identical it is, which is most probably responsible for pulling their left hip up in the air to cause their twisted pelvis. Then notice how they both have a protruding shoulder blade and all their abnormalities are on their right side. They both have shortness of breath, they both can't jog, and they're both having trouble with walking. Yet they're diagnosed with 2 completely different rigidity autoimmune disorders. Natural practitioners of the future need to know what all this means, and they need to know how to work side by side with chiropractors to overcome all these abnormalities, as well as degenerative discs, spinal kinks like with Barry Black, and other causal problems involved in the onset of these particular musculoskeletal abnormalities. So now let's look at Tom and Jeff, the Parkinson patient paired with the irritable bowel syndrome patient. So looking at Parkinson's patient Tom and his back muscle distortions that match with the curve in his spine and his subluxations, we can see a tunnel of muscle here all swollen, changing the shape of the spine, and another tunnel of muscle going across the spine here, meeting these 2 red arrows, and inside this red bracket that's changed the alignment of the mid-thoracic area here to create his symptoms. Now if you look closely at the abnormalities in Jeff's muscular system that's supposed to be supporting his spine and keeping it in line, he has a tunnel of muscle similar to Michael and Bart that is pushing on his spine and causing a curve in the mid-thoracic area as well. Remember, this is the area of the diaphragm and the lungs, and all four of these patients so far had shortness of breath when they walked a fair distance, they had trouble walking, they couldn't jog, and they all had a twisted pelvis, a spinal curve, and a C1 subluxation. Okay, so now let's look at Bill and Abby, Parkinson patient and Hashimoto's disease patient. So if you look at the swelling in Bill's muscular formation that's supposed to support his spine, you can see he has a really big area of swelling there and a curve in his spine that matches that swelling. He also has a protruding left shoulder blade and excess muscle tension all the way from the side of his neck down to his deltoid muscle and across down his latissimus muscle. And his spine is curved to the shape of all those swellings. Now the same thing applies to Abby with Hashimoto's disease. You can see all these areas of swelling. This one in particular, a very big one, and that's the side where his hip is up to cause his twisted pelvis. So it's safe to assume that this large muscle swelling, this tubular area similar to Michael, Bart, Tom and Jeff, is the reason he has a twisted pelvis, or at least part of the reason. You can also notice a tunnel of muscle there and a protruding shoulder blade here and excess muscle tension all the way from his neck down. But Abby has excess muscle swelling on both sides, whereas Bill only had it on the left side. If you look at their x-rays, they both have terrible forward head posture, and their x-rays confirm the damage that's doing to their discs, and they also have a lumbar curve showing in their lumbar spinal x-rays. Now let's look at Sherry and Janice down here. Now these two are quite exciting. They're much the same as the others. They're pretty much identical in most ways, except the muscle formations are slightly different in all of them. But if you look at Sherry, you can see most of her tensions are on the left side. She has a protruding shoulder blade on the left side. She has a twisted pelvis with the right hip up and a tunnel of muscle there, probably pulling the hip up. And there's a spinal curve matching all of that. You can see the way she stands, that matches with the curve and the twisted pelvis. Now if you look at Janice, the same thing. She has a tunnel of muscle here, she also has a tunnel of muscle there, a protruding right shoulder blade. Whilst most of her problems are on the right side, she does have a swelling of her lumbar muscles here, and her spine curves according to all those abnormal swellings. So now let's take a look at Debbie and Pauline. If you take a close look at MS patient Debbie, you can see all her excess muscle tensions are on the right side. She's actually leaning over to the right. She has that tunnel of muscle there pulling on the hip, yet it's her left hip that's up in the air. But there are other reasons for that which I won't go into here. If you look at Parkinson patient Pauline, you can see most of her problems on the right side, and she's leaning to the left. She has a twisted pelvis, the right hip is up in the air, and she has a tunnel of muscle here, possibly responsible for pulling that right hip up, and she has extreme muscle swelling and tension across the back of her neck and down the side of this trapezius muscle down to the deltoid. She has two curves that match with the muscle tensions, and the common denominator with all of these muscular-skeletal abnormalities is that the very moment I begin to correct these abnormalities while working in conjunction with a chiropractor is the moment that the symptoms these patients suffered began to go away. On many occasions I've had my clients tell me that their doctor or neurologist had difficulty deciding which rigidity disease they had. And the reason for this is because all 9 of the diseases on my list have no real test that doctors and neurologists can use to identify any one of them. In their medical school training, doctors and neurologists are taught to make a decision according to the symptoms. and all the symptoms begin with muscle rigidity and a neck pain, usually right up high around the C1 vertebra. Another confusing factor is that all 9 diseases are listed on medical websites as having pretty much the same symptoms.